California task force to study and develop reparation proposals for African Americans. Content warning. It contains discussions of racial discrimination, sexual assault, torture, lynching, and other forms of extreme violence. Contains unedited historical quotations and photographs of white supremacist hatred, torture, lynching, autopsy, and other forms of graphic violence.
12 Public Health Crises. Scholars have theorized that the federal and state government's racist public health practices, along with centuries of slavery, segregation, and white oppression, have resulted in entrenched systemic racism, which has harmed African American health. 610 The public health crises described in this section are not an exhaustive list of the mismanagement of health crises, rather, they are selected illustrative examples today. African Americans continue to be at the highest risk for negative health impacts from public health crises. 611 Infectious diseases. In 1793, anti-black racism on the part of state officials in Pennsylvania resulted in the death of hundreds of African Americans during the yellow fever epidemic. 612 At the time, medical historians and prominent white leaders, assuming black people were immune to the disease, encouraged African Americans to assist with managing the epidemic. 613 Many black residents remained in the city, instead of fleeing, participating in the epidemic relief effort, caring for the ill and burying the dead. 614 In the end, hundreds of African Americans died from yellow fever. 615 In the post-Reconstruction era, tuberculosis was a deadly health problem for African Americans. 616 In 1900, there were large disparities in tuberculosis rates between white and black populations because segregated black neighborhoods were impoverished, had congested housing, and could not access basic healthcare information. 617 In the early 1900s, state and local public health agencies, hospitals, and physicians portrayed black people as a hazardous population to the white public. 618 In 1964, black tuberculosis rates were 2 to 3 times higher than for white Americans. 619 Substandard and segregated housing, in addition to concentrated poverty, contributed to high HIV and tuberculosis rates in the 1980s and 1990s. 620 The disease spread widely in prisons, hospitals, cramped housing, and homeless shelters, leading tuberculosis rates to increase among African Americans. 621 Due to a combination of government neglect and systemic racism, African Americans have been harmed by the spread of infectious diseases. Black youth are 3 times as likely to be incarcerated in the juvenile justice system and less likely to be diverted to non-carceral settings than white youth. African American youth involved in the carceral system have worse mental and physical health during and after incarceration. This is due to communicable diseases, which spread in juvenile facilities, physical and sexual trauma, as well as erosion of mental health. Drug addiction. Internationally, public health officials have recognized that drug addiction should be treated as a health disorder and not as a criminal behavior. 622 The federal government has chosen to respond to rising drug addiction as a criminal justice issue, instead of as a public health issue. 623 This has resulted in state action against black people in need of substance abuse services. 624 According to healthcare providers and experts, the government should treat drug addiction as a public health issue. 625 Drug addiction as a medical condition, not a flaw in character. 626 Punishment for substance abuse disorders does not treat addiction, it leads to higher risk of drug overdose. 627 By the 1980s, the government embarked upon a rigorous crackdown on the usage of crack, a crystallized type of cocaine which is highly addictive and relatively cheap. 628 During the 1970s, hospital immersion. XII rooms began testing pregnant women for suspected drug use and reporting them to police authorities. 629 In many cases, hospitals imprisoned women, shackled them while they gave birth. or took temporary or permanent custody of their children. 630 hospitals reported black pregnant women 10 times more frequently to government health authorities than white women. 631. State policy leaders did not address the need for increasing preventive mental illness and rehabilitation resources. 632. Nor did they address the psychosocial origins for the demand for crack. 633. Police crackdowns and incarceration for drug possession did not relieve the social conditions that spawned the crack cocaine epidemic, but rather created harmful consequences for African Americans. 634. State actions exacerbated them by treating drug addiction as a crime, as opposed to a public health issue. 635. By the year 2000, over 80% of those charged with crack-related crimes were black, while less than 6% were white. 636. Throughout the course of the crack epidemic, sentencing disparities caused African Americans to receive excessive sentences in prison, and many continue to serve such excessive sentences today. 637. HIV/AIDS. During the 1980s, AIDS harmed black communities severely, especially LGBTQ black populations and intravenous black drug users, who were overrepresented among AIDS victims. 638. Today, the prevalence of HIV is especially high within the African American LGBTQ community. 639. Black, gay, and bisexual men are infected by HIV more than any other group in the United States today and have the highest HIV death rate. 640. Between 2010 and 2019, the number of HIV infections among white gay men decreased significantly, while the number of infections among African American gay men did not decrease. 641. Long-standing inequities in access to and delivery of health care to African Americans has led to this disparity. 642. Black women accounted for the largest share of women living with an HIV diagnosis in 2017. 643. Due to the lack of federal or state-funded healthcare resources for the AIDS epidemic, black healthcare leaders and organizers worked to connect AIDS victims to medical services, benefits, and health education. 644. Churches and community organizations formed to educate African Americans about sexual health and AIDS prevention. 645. They worked with black LGBTQ populations to educate them about safe sex practices and to provide outreach and health services to people with AIDS. 646. Despite this work by African American communities, the Centers for Disease Control and Prevention planned to cut funding from dozens of groups operating AIDS services. 647. Nutrition. African Americans are more likely to live in food deserts, areas with limited access to healthy, affordable food. 648. For a more detailed discussion of discrimination in infrastructure, please see Chapter 7 on racism in environment and infrastructure. Tobacco products, such as menthol cigarettes, have been historically marketed to black communities by tobacco companies at higher rates than white communities. 649. Despite regulating and banning other products, the federal government did not consider banning menthol-flavored tobacco products until 2021. 650. Additionally, the overconcentration of liquor stores in African American neighborhoods is correlated to African American health problems. 651. The makers of sugar-sweetened beverages, fast foods, and other products also often target black communities in marketing schemes. 652. These food products contribute to overconsumption, leading to diabetes, obesity, and other health problems. 653. Between 2005 and 2008, black adults consumed nearly 9% of their daily calories from sugar drinks, compared to about 5% for white adults. 654. Black children and teens see more than twice as many ads for certain sugar drinks than their white peers. 655. Lower-income black neighborhoods have disproportionately more outdoor ads on billboards, bus benches, sidewalk signs, murals, and store window posters for sugar drinks. 656 Sugar has had disproportionately negative consequences for Black people, and is linked to diabetes, obesity, and hypertension. 657 Marketing companies are protected by law under the First Amendment, while Black youth are not protected from the harmful consequences of their actions. 658 Natural disasters. The federal government has engaged in the racist mismanagement of natural disasters like hurricanes. A prime example is Hurricane Katrina. Racial health disparities among Black communities in New Orleans existed prior to Hurricane Katrina. 659 This was due to lack of health insurance for low-income residents, high levels of infant mortality, and high levels of chronic disease. 660 Charity Hospital, a state hospital in New Orleans, had been the center of hospital care for poor African Americans prior to Hurricane Katrina. 661 3/4 of its patients were Black, with incomes below $20,000. 662 The hospital provided care for HIV/AIDS, drug abuse, psychiatric care, and trauma care. 663 After the hurricane, the state did not reopen Charity Hospital, leaving poor African Americans in New Orleans without medical care. 664 Following Hurricane Katrina, Black communities received diminished medical care that amplified health disparities, while white communities were restored to even better conditions than they had lived in before the hurricane hit. 665 By 2010, 34% of the Black population in New Orleans was living in poverty, compared to 14% of white people. 666 Black youth in New Orleans were 4 times more likely to die from any cause than their white counterparts. 667 There were increased death rates for African Americans from kidney disease and HIV. 668 From 2009 to 2011, 1/3 of Black residents lacked health insurance, double that of white Americans. 669 The federal government directed funding to repair the buildings, bridges, and streets of New Orleans. 670 However, the government did not address the rampant poverty and health disparities among Black people that had been exacerbated by Hurricane Katrina. 671 COVID-19. Today, African Americans are disproportionately at risk for COVID-19 infection and death due to structural factors such as healthcare access, density of households, employment, and pervasive discrimination. 672 As of March 2022, African Americans are 1 times more likely to contract COVID-19, 4 times more likely to be hospitalized due to COVID-19, and 7 times more likely to die from COVID-19 than white Americans. 673 The federal government suggests that long-standing racial inequities contribute to worse COVID-19 outcomes for Black people. 674 Factors that increase COVID-19 risk for African Americans include unaffordable housing, lack of healthy food, environmental pollution, poor quality health care, poor health insurance, essential worker jobs, lower incomes, greater debt, and poorer access to high-quality education. 675 All of these factors disproportionately harm African Americans due to systemic racism. Courtesy of James Nielsen, AFP via Getty Images. National Guardsmen stand watch at barricades outside the Superdome as emotional refugees driven from their homes by Hurricane Katrina await evacuation from the flooded city of New Orleans. Following Hurricane Katrina, African Americans in New Orleans received worse medical care than white Americans, which made pre-existing disparities worse. Living conditions for white Americans in New Orleans were restored or improved upon when compared with conditions before the hurricane hit. September 1, 2005. California. The state of California has also engaged in the mismanagement of public crises in ways that have harmed African Americans in California. The criminal justice system excessively targeted African Americans during the crack cocaine epidemic in Los Angeles. Black Californians would receive up to a 10-year federal sentence, while white Americans prosecuted in state court faced a maximum of 5 years and often received no more than a year in jail. 676 From 1987 to 1992, a University of California Los Angeles study found there were no white Americans among the 71 defendants prosecuted federally by the U.S. Attorney's Office in Los Angeles. 677 This discriminatory prosecution occurred even though studies showed that white Americans accounted for the majority of people who used crack cocaine in Los Angeles. 678 As of 2017, California incarcerated African American men at 10 times the rates of white American men, resulting in devastating health impacts for the African American community. 679 Black women are imprisoned at a rate that is more than 5 times that of white women in California. 680 Black Californians are also overrepresented among California's unhoused. 681 The overrepresentation of Black Californians among the unhoused and incarcerated populations, both of which are vulnerable to COVID-19, means that Black Californians are consequently at higher risk of contracting COVID-19 and other illnesses. 682 California is also home to many food deserts that harm African American health. In South Los Angeles, many Black Californians do not have enough grocery stores, access to organic produce, thriving small businesses, affordable housing, or medical services. 683 In View Park area, a majority Black South Los Angeles neighborhood, the nearest grocery store is an Albertsons more than a mile away. 684 Black residents have been forced to engage in urban micro-farming, building community gardens and mini markets to compensate for the lack of healthy available food. 685 The trifecta of liquor stores, smoke shops, and marijuana dispensaries in Black neighborhoods in California has resulted in inadequate access to healthy foods. 686 Maria Rutledge, a Black resident of South Los Angeles, said, "We are in desperate need of a real grocery market in the area that is welcoming to families, provides healthy food choices, and that supports a safer environment." 687 In addition to the lack of grocery stores, there is an overabundance of liquor stores. 688 During the early 1990s, there were 728 liquor stores in a 54-square-mile radius encompassing South Los Angeles. 689 While that number has decreased, South Los Angeles communities are still overrun by liquor stores, with approximately 85 liquor stores per square mile compared to 197 liquor stores per square mile in West Los Angeles, a majority white neighborhood. 690 The trifecta of liquor stores, smoke shops, and marijuana dispensaries in Black neighborhoods have indirectly resulted in sexual harassment, violence, and a climate of fear, leading to poor mental and physical health for Black Californians. 691 In California, COVID-19 infections disproportionately affect African Americans. As of March 2022, the death rate for Black Californians due to COVID-19 is 18% higher than the COVID-19 death rate for all Californians. 692 According to a survey conducted by the Association of Black Psychologists, about 40% of Black Californians wished they had more support during the COVID-19 pandemic. 693 13 Impact of racism on Black health. Systemic racism has culminated over centuries in severely damaged physiological health for African Americans. 694 Some scholars have argued that medical discrimination in the United States against African Americans is so severe that it is a form of biological terrorism. 695 Low life expectancy. Lack of access to health insurance, and high rates of disease have resulted in great physiological harm to African Americans. 696 State-sanctioned systemic racism has led to environmental racism, urban poverty, and over-incarceration, all of which have harmed the health of African Americans. 697 The cumulative effect of institutional racism by federal and state governments has led to racial trauma that has had intergenerational impacts on the mental health of African Americans. 698. As of March 2022, African Americans are 1.1 times more likely to contract COVID-19, 2.4 times more likely to be hospitalized due to COVID-19, and 1.7 times more likely to die from COVID-19 than white Americans. Health outcomes. African Americans have higher rates of morbidity and mortality than white Americans for almost all health outcomes in the United States. An inequality that increases with age. 699 African Americans suffer disproportionately from cardiovascular disease relative to white people. 700 In surveys of hospitals across the country, black patients with heart disease receive older, cheaper, and more conservative treatments than their white counterparts. 701 They also suffer from higher rates of diabetes, hypertension, hyperlipidemia, and obesity. 702 These are all risk factors for cardiovascular disease. 703 This is linked to the fact that African Americans suffer from weathering, constant stress from chronic exposure to social and economic disadvantage, which leads to accelerated decline in physical health. 704 Social environments that pose a persistent threat of hostility, denigration, and disrespect lead to chronically high levels of inflammation. 705 Studies have shown that black youth who are exposed to discrimination and segregation have worse cases of adult inflammation due to race-related stressors. 706 In fact, race-related stress has a greater impact on health among African Americans than their diet, exercise, smoking, or being low-income. 707 Cortisol, which is a stress hormone, locates itself in bodies in response to racism. Consequently, African American adults have higher rates of cortisol than their white counterparts, and this is linked to cardiovascular disease. 708 Therefore, exposure to racism as a child or adolescent lays the foundation for inflammation and subsequent health disparities. Even middle and upper-class African Americans manifest high rates of chronic illness and disability. 709 Discriminatory attitudes and behaviors by healthcare professionals may also contribute to misdiagnosis and mismanagement of cardiovascular disease among black patients. African Americans disproportionately lack access to renal transplants due to racial bias exhibited by physicians, as well as institutionalized racism. 710 African Americans are less likely to be identified as transplant candidates, referred for evaluation, be put on the kidney transplant waitlist, receive a kidney transplant, and receive a higher quality kidney from a living donor. 711 Black patients with sickle cell disease are discriminated against by medical providers who display racist attitudes and accuse people with sickle cell disease of faking their pain. 712 This results in inadequate treatment. 713 There are many reports of black children with sickle cell disease who do not receive screening tests and treatment necessary to prevent strokes that can occur due to the disease. 714 Racial disparities in black health outcomes occur today as a culmination of historical racial inequality, discriminatory health policy, and persistent racial discrimination in many sectors of life in the United States. 715 Discriminatory health systems and healthcare providers contribute to racial and ethnic disparities in healthcare. 716 The U.S. Office for Civil Rights within the U.S. Department of Health and Human Services is charged with enforcing several relevant federal statutes and regulations that prohibit discrimination in healthcare, such as Title V of the 1964 Civil Rights Act. 717 However, the agency is under-resourced and has not been proactive in investigating healthcare-related complaints from the public, conducting compliance reviews of healthcare facilities, or initiating enforcement proceedings for civil rights violators. 718 For example, the Office for Civil Rights could identify examples of discriminatory practices, require the collection and reporting of demographic data, and conduct investigations. 719. Policing and incarceration. Policing and incarceration have clear adverse consequences for the health of African Americans. Racial inequality and racial bias occur in all aspects of the criminal legal system. With federal and state governments over-incarcerating and disproportionately punishing African Americans. 720. For a more detailed discussion of discrimination in the criminal justice system, please see Chapter 11 on an unjust legal system. Police violence kills hundreds of African Americans and injures thousands each year. 721. Incarcerated people, who are disproportionately black, face a high risk of death after they are released from prisons and jails due to poor health as a result of incarceration. 722. Prisons and jails have been major sites of disease transmission. 723. The churn in and out of incarceration can result in community spread of sexually transmitted infections or other infectious diseases. 724. Studies have shown that black youth who are exposed to discrimination and segregation have worse cases of adult inflammation due to race-related stressors. In fact, race-related stress has a greater impact on health among African Americans than their diet, exercise, smoking, or being low income. African Americans are overrepresented in state carceral facilities, are less likely to receive the latest psychiatric medications, and have greater difficulty in achieving successful community integration once they leave carceral facilities, further harming their mental health. 725. State prisons often force incarcerated African Americans into solitary confinement at higher rates. 726. Solitary confinement has serious documented harmful mental health effects. 727. Anti-black government action harms the mental health of black communities. Police violence can harm mental and physical health for black communities through constant surveillance and threats of violence. 728. Studies have shown that African Americans who view racist materials experience an increase in blood pressure. 729. Scientific evidence shows that police killings of unarmed African Americans have adverse effects on mental health among black adults in the general population. 730. Mental health screening tools used in state and federal carceral facilities reproduce racial disparities, resulting in fewer African Americans screening positive for mental illness. 731. Thus, African Americans remain under-referred and undetected in the jail population. 732. Environment. State and federal underfunding of medical resources combined with unhealthy physical environments, unemployment, and poverty in black communities has led to a public health crisis. 733. Urban neighborhoods have the highest rates of preventable diseases and lack health insurance and adequate housing. 734. By 1980, urban neighborhoods were where 60% of the nation's black population lived due to redlining and historical housing segregation. 735. Black communities continue to experience disproportionately high rates of chronic diseases linked to environmental racism. 736. For a more detailed discussion of environmental racism, please see Chapter 7 on racism in environment and infrastructure. Build up pollution from abandoned industrial and commercial work sites resides in soil, water, structures, and air. 737. Asthma, cancer, and childhood disorders that affect black communities are linked to polluted environmental conditions such as toxic waste exposure and lead poisoning. 738. Segregation adversely affects the availability and affordability of care, creating a lack of access to high-quality primary and specialty care, as well as pharmacy services. 739. A review of nearly 50 empirical studies generally found that government-facilitated segregation was associated with poorer health. 740. The state-perpetrated discriminatory practice of redlining officially ended in 1968, but it created residential segregation. which continues today. 741 segregation has been found to be positively associated with later stage diagnosis, elevated mortality, and lower survival rates for both breast and lung cancers for Black people. 742. Housing segregation excessively exposes Black communities to pollution and isolates African Americans from healthcare resources, including pharmacies, clinics, hospitals, and healthy food stores. 743 disparities in life expectancies between Black and white people are rooted in policies that oppressed and segregated African Americans. 744 evidence shows that gaps between white and Black life expectancy are dependent on zip codes and housing segregation. 745. There may be other cumulative negative effects of institutional and systemic racism which have yet to be studied by scientists. A public health study conducted in 2021, for example, revealed that repeated use of chemical irritants for crowd control by local and federal law enforcement during racial justice protests in the U.S. likely harmed people's mental and physical health. 746. California. Black Californians experience the shortest life expectancy than any other race or ethnicity. 747. In the San Francisco Bay Area, life expectancy is more than 5 years greater in white neighborhoods, 84 years, than highly segregated Black neighborhoods, 79 years. 748. Black Californians have the highest mortality rate in 9 out of the top 10 causes of death in San Francisco. 749. A high number of Black Californians live in southwest Fresno, an area with lower life expectancy than the affluent neighborhoods of Fresno. 750. Black Californians suffer from the highest cancer rates among all races in colorectal, prostate, and lung cancer. 751. Black men are dying of prostate cancer at almost 5 times the rate of white men in California. 752. In 2015, Black Californians had the highest rate of preventable hospitalizations for diabetes, heart disease, asthma, and angina. 753. Black youth suffer from the highest number of asthma cases in California. 754. Black children in California tend to live in areas with higher levels of traffic-related pollution, which contributes to higher levels of asthma. 755. Historically redlined census tracts in California have significantly higher rates of emergency department visits due to asthma. 756. This evidence suggests that redlining might be contributing to racial and ethnic asthma health disparities. 757. Black Californians are the most disproportionately affected by the HIV epidemic due to racism, in part. 758. In 2018, Black Californians were approximately 6% of California's population, but they were 18% of California's HIV-positive population. 759. Among women newly diagnosed with HIV, 31% were Black Californians. 760. Black transgender people were for 14% of those who were newly diagnosed with HIV. 761. Consequently, Black Californians are overrepresented among the HIV population. Police violence and incarceration have greatly damaged the health of Black Californians. Black Californians account for 20% of serious injuries and fatalities due to police use of force. Even though they are only 6% of the population. 762. More than 4 in 10 Californians shot by police were identified as suffering from a mental health condition, having an alcohol or drug-related disorder, or both, according to hospital data. 763. In Brown versus Plata, the Ninth Circuit Court of Appeals ordered the state of California to reduce overcrowding in its prison population due to inadequate health care for incarcerated people. 764. Black Californians in Los Angeles jails who have mental health conditions report receiving harsher sentences and less alternative treatment programs than their white counterparts. 765 Due to the overrepresentation of black Californians in the prison and jail systems, inadequate prison health care greatly diminishes the overall health of black Californians. 766 Housing segregation excessively exposes black communities to pollution and isolates African Americans from healthcare resources, including pharmacies, clinics, hospitals, and healthy food stores. 14 Conclusion. The legacy of slavery has destroyed the health of black communities through segregation, racial terror, abusive experimentation, systemic racist oppression, and harmful racist neglect. Today, African Americans face racial discrimination from healthcare providers across the entire healthcare system, which has contributed to the overall destruction of African American health. 767 African Americans suffer from low life expectancy and high mortality rates across virtually every category of health. 768 Due to historical and contemporary traumatization from racist violence, racist microaggressions, and institutional racism, African Americans often suffer from serious psychological distress. 769 The mismanagement of public health crises by state and federal governments has resulted in additional adverse health consequences and deaths in black communities, most recently during the COVID-19 pandemic. 770 In some cases, the racial health disparities between black and white Americans are worse today than they were during the period of enslavement. 771 The racist dehumanization of African Americans in the United States began with the institution of enslavement and its degradation of African American health since then. This racist dehumanization has been sustained by a healthcare system that destroys black health through overt and covert discrimination by medical providers, public policies that neglect African Americans' health needs, hospital systems that continue to be segregated, medical schools that systematically exclude African Americans, and a health insurance system designed to be inaccessible to poor African Americans. 772 The United States healthcare system was designed during the time of enslavement to keep enslaved people alive for profit, but not to take care of their health. 773 After slavery was abolished in name, this healthcare system continued to operate in the same manner, segregating, excluding, harming, abusing, experimenting upon, and slowly degrading African American health. 774 To atone for the violence of slavery and its destructive impact on black health, health-based reparations must be awarded to African Americans. 775